Hey, my name is Liz. I'm one of the master injectors here at Juvly Aesthetics. And today we're talking about Botox and Dysport and what the difference is between the two of them. So Botox and Dysport are both neurotoxins that we use to relax selected muscles that we place it into, and thereby allow the skin lying on top of it to relax and smooth out wrinkles that we might be seeing. So the most common areas that we treat with Botox or Dysport tend to be the glabella, which some people call the 11s between the brows, the upper forehead where we get the horizontal creases, and then crow's feet around the eyes. So one question that we get asked all the time is which one is better, Botox or Dysport? So both of them are FDA approved to relax these areas and help smooth out the wrinkles. So Botox was introduced first, and that's why it's the most popular and the most widely known. But to compare the two, a lot of times we'll make the analogy that it's like Coke and Pepsi, two brand names of essentially the same thing. So they work in slightly different ways, which causes Dysport to sometimes kick in a little bit sooner, and it causes the Botox to kick in a little bit later on. So usually we tell people wait a full 10 days for the full effect of both products, and then eventually at some point in the course of your treatment, try both of them and see which one seems to work a little bit better for you. So cost-wise, they end up being about the same area for area, and that's because with Botox and Dysport, they're measured differently. Dysport is cut up into slightly smaller molecules, and so their units are a little bit less than Botox units. So at our office, the conversion rate is about 1 unit of Botox to 3 units of Dysport. So that makes the cost end up being essentially the same area for area. So when we're talking about treating these 3 common areas, the 11s, the forehead, and the crow's feet, often we get asked how many units am I going to need for these areas. So the treatment is all very personalized to what your face and your muscles need. So one treatment does not fit all. So the most common treatment numbers on these areas, I would say the crow's feet, typically most people are between 10 to 12 units per side. And for the area between the brows, most people are roughly 20 units. And across the forehead, that one can vary quite a bit more. So most people between 8, possibly 14 units on the upper forehead. And that's talking in Botox units. So remember, the conversion factor is 3 units of Dysport for every 1 unit of Botox when we're talking about those areas. So if you'd like to know what the best treatment is for your face and for your individual skin needs, book a free consultation online or by phone. Thank you for watching.